welcome to the Chesapeake Thrive Show. I'm Mary Riley, and today I'm here with Ray Shively from Healthier 757. Good morning, Ray.
Good morning, Mary.
And thanks for being here today. Can you tell us a little bit about Healthier 757?
I sure can. And first, thank you very much for inviting me and giving me the opportunity to talk to your viewers. It's an exciting opportunity. So Healthier 757 is a nonprofit regional initiative that was started a few years back and with the mission of improving health literacy, addressing health equity and economic prosperity throughout the 757 region, hence the name. One of our most important engagements from the very beginning has been with the city of Chesapeake. And so it's really exciting to be here and to be part of the Chesapeake Thrives program.
Well, great. We're so happy to have you as part of our health priority area. Can you tell me a little bit about the Rewards for Healthy Living?
So Rewards for Healthy Living is the app that is our game-based learning platform that people use to access multimedia education, win prizes, win cash, get incentives to learn about their health and improve their health, and also to make it fun, because some of these education topics can be a little dry. The pamphlets you get at the doctor's office, you know, how many people really read them all and keep them? And what we do is we make it fun, engaging, and somewhat entertaining to learn about how to better manage your health and that of your family.
So why should I do that?
Well, a lot of reasons. Of course, health is, obviously important to everybody, but not only can you have a lot of fun, but our platform, our app is very rich and full of a lot of information. It's a lot. And we cover an array of topics. We really hit the chronic diseases strong, the things that are most important to our community and that are affecting a lot of members of our community, like diabetes and high blood pressure and breast cancer and prostate cancer, particularly in our underserved communities. This is a good solution to help people learn in, a fun and engaging way. And so not only can I learn about how to better manage those conditions, but also we have a tremendous amount of resources for families, for kids, for mental health. So there's a lot there, and seniors, and I could go on, but there's a lot there.
Well, so it's an app, but is it free?
It is free. So the way this works is Healthier 757 is a nonprofit initiative, and through grants and philanthropic support, we provide the funding necessary to make the app available. And part of what I do in my job is work with partners like the city of Chesapeake and others throughout the region to promote distribution of the free app into areas in the community and in public health as an asset. And yes, it's 100% free. And there's no upsells, there's no, people say free all the time and then they get in there and then they get charged something. There's never a charge. And I'm also in charge of security, and we're HIPAA compliant and we're secure, and we never share anybody's information.
So I have to give you some of my information. So I'm glad you said that about not sharing information.
Yes, ma'am. It's very minimal though. We don't ask for much, but what we do ask for is confidential and highly secure.
And this is Heart Healthy Month. So can you tell us a little bit about what you're doing with on the heart side?
It's actually one of my favorite topics, because in Hampton Roads, if you throw in diabetes, heart health is almost a crisis. And all of the communities, all the cities, certainly the city of Chesapeake, education is critical, and helping people to manage the chronic diseases associated with chronic disease. And that includes high blood pressure, that includes stroke, that includes heart disease, heart failure. And we cover those topics really extensively. And, if we're going to solve these problems, there's a lot of aspects to it, as you well know, but a key thing is education. And being able to prevent some of these diseases from coming on. It involves basics: diet, exercise, mental health. These are all key factors, and they contribute, frankly, to most of the chronic diseases plaguing our community. So we provide a fun way to try to learn about those things and try to really manage some of those chronic conditions.
Well, it does sound like a lot of fun. So tell me what happens when I go into the app, and then what happens?
So you go into the app and there's a personalization. So that's, we kind of know a little bit about you, not a lot, but a little bit. There's it's an easy navigation. It's a mobile responsive web app, not to get too technical, but what people are familiar, I think, with that format now. You don't have to download anything from the app stores, and it runs on your phone like an app, and you save an icon. And so people can use it, and it feels just like an app that you download from the app stores. You navigate to various topics. We have them organized in chronic diseases and well-being, and we have things on managing, your healthcare and understanding the healthcare system, how to pick insurance, directives, just so much. I mean, so it's pretty easy to get into, but once you do, each of these modules, and we have 85 now and they're growing, they're a whole experience onto themselves. So if you're going to learn about your high blood pressure, you go in there and it's a whole multimedia experience, but you get to pick what you like and you get to learn in the way that matches what your style of learning is.
What your interests are too. Yeah.
Mm-hmm. Yes, ma'am.
Well, this is very exciting, Ray, and we're really excited about having Healthier 757 as part of our priority area. And we look forward to the other aspects of the app or the rewards that you'll be adding. But can you just tell me a little bit, but do I get reminders or anything? Or
You do. So part of the neat thing about, or cool thing about our app is that we have daily engagement strategies. So you get a daily reminder. You can turn it off. So we don't want to annoy people, but it'll remind you each day to play. We have what we call a health scratch ticket, which is a daily question, a general health question, and you go on with your finger, or if you're on your computer with your mouse, and you scratch the ticket just like you would, like one of the ones you get at the convenience store, and you answer the questions, and then you get points, and then those points add up, and as you accumulate points, everything you do on the app gives you points. And so you feel like you're doing things. You get a letter grade for each module you complete, so you can measure how much you're learning. You can share it, with friends and family. But then you get points and you get put into the Health Scratch lottery. And right now we give away $1,000 a month in cash and prizes, and then we have an annual $5,000 winner. And so that's a lot of fun. And of course, part of our push for raising funds, a big part of it is to increase those rewards. We want to get people in the community excited, where they can win larger amounts of money and get them talking about it and having fun with it,
Well, it does sound like fun and a great way to learn more about my health or our health. But again, thank you for being here today. This is very exciting. I learned a lot just from talking to you today. So we look forward to our viewers getting more into Healthier 757 and the rewards for healthy living.
Well, we're excited and honored to be a part of it. And, our work with Healthy Chesapeake has been phenomenal, and really excited to work with the hospital and the libraries as well. And so this is just a continuation of some of the momentum that we've developed with those organizations and CIBH and others. And it's just really exciting, and we're happy to be part of it.
Yes. Well, we love this partnership, and we're glad to have you. So thank you.
Thank you.
Have a great day.
You too.